Hi everyone, good morning. I'm Prerak. I represent an organization called Catalyst Management Services from Bangalore, India. It's part of the larger Catalyst Social Enterprise platform, which hosts different organizations with focus areas across, let's say, public health, livelihoods, climate, governance, and likewise. We are based out of Bangalore in India and have been working in the social impact space for last about 30 years. And our footprint spans across multiple countries, across 25 different countries in Southeast Asia, then some of work in Africa as well. So today I'm going to talk about the precision analytics in action towards climate and health. In a short form, it's called PATCH. It's a framework and early warning system intelligence tool that has been developed to respond to various climate and health mediated risks that are emerging across the world now, and specifically in the lower and middle income countries. And this initiative has been started by Swasti, a public health organization, which has been working in this space for about 20 years and anchored by them across different countries with relevant partners as well on the ground. So, I'll just go into the details of what we aim to do. We all of us are aware of what we are trying to solve here, right? So basically, idea is that okay, climate change is affecting different health system. We are aware of that. Okay, every year on year, the temperature is changing, the floods, the landslides, the droughts, all of them have become very uneven as well, right? And these are unpredictable, respectively. And most of the brunt that is faced by all these events are towards the vulnerable communities who do not have access to the basic necessities and the resources, right? So our work at Swasti has been largely to improve well-being of vulnerable communities and add about 100 million healthy days by 2030. That is what we are aiming and working towards. So a lot of our efforts from Precision Health platform over last 4 to 5 years has been around setting up the systems, converging with the government departments, and scaling it across the states to help governments and the relevant departments and the civil society organized to operate on the ground where they can work closely with the vulnerable communities to improve their livelihoods, right? So this is just a context where all of us are aware that, okay, climate change is affecting everyone and this is going to be there for next decade or so. And how do we help vulnerable communities protect themselves and react or respond to the different events that are happening in much more effective manner? But for vulnerable communities or any institution to even react to that, they should be aware, okay, there is an upcoming event or there is a distress event that is going to happen. So that is what the precision health is all about. This is just a more broader scenario on we all of us are aware, right? All the climate events like flood, heat, drought, the risks are massive and they are increasing as well. Specifically in India, where we are based out of, we have seen that across different states, things have changed drastically. Let's say in Northeast, in a state like Meghalaya, where dengue and malaria and all used to be very unknown term, now it has become so prevalent that now government is addressing that in a systematic manner, right? Similarly, in Tamil Nadu, where they used to have, let's say, monsoon rains about early, I think October, November, and then later in the late monsoon rains also around January, right? But now there is a reversal in the pattern itself. Probably instead of lack of rain, now there is a floods that are coming in the state. Likewise, each of the state in India faces different challenges, and especially when where the vegetation is higher, they also face uh, other challenges with, let's say, zoonotic diseases, veterinary diseases, and all of that, right? Besides that, we also see that there is a lot of antimicrobial resistance that is increasing across the country, not by the study, but in a general consensus across the practitioners is also that certain antibiotics that used to be more effective are not that effective now, let's say, right? So there could be underlying potential antimicrobial resistance that could be developed, and there are accepted papers as well, right? So what Patch basically aims to do, Patch is an architecture or I would say convergence platform where we sort of bring different data sets together to help government or likewise any system actors who is working towards vulnerable community on improving their well-being in getting the right intelligence via, let's say, bringing different data sources together, via, let's say, convening different stakeholder workshops, via, let's say, having community voices being heard to the government, all of that different tools. I'll talk about those tools in a bit. But why these tools and convergence platform is more important, because it's not only about bringing data system or creating an architecture, but also working with the different government systems and relevant entities to define the problem itself, right? Probably the problem that we might see in Meghalaya may not be the same in, let's say, Tamil Nadu state of India. Likewise, whatever we are seeing in Gujarat may not be applicable in, let's say, even Bihar. How do we even work with the government or local partners to help and understand what are the key challenging area that they are facing, especially from the public and climate point of view? Then bringing right data sets and the architecture together to address that in a timely manner, so the early warning system can be set up and operationalized, right? While we do that also, we also co-create the same system with the users who are going to use it. So keeping human in the loop and having a user-centric design is the core principles for us, where we ensure that whatever we are developing is with the support of those local partners and governments, right? In the past of about 4 or 5 years across, let's say, COVID and different events that has happened across the country, we have had different tools working on this together, right? So we started with, let's say, wastewater surveillance, which is based on the water-based epidemiology. Then we expanded that to, let's say, GIS-based vulnerability mappings. Then we also have an in-house tool for event-based surveillance, which sort of scrapes all media articles to give an early warning system where likely spread is going to be. I'll talk about some of this in the detail as well. But what all of this tool helps us is a hyper-local solutions that basically helps in identifying where the distress or the event is likely to happen, and also give that particular information to the local partners, since we are also anchoring a collaborative for about 400 organizations are spread across the country, where we can disseminate this information to those local partners and the government systems as well, saying that, okay, there is a distress that is likely to happen. So how do we act on it and provide relevant support that is required for it, right? So we also have a risk communication entire material, which also helps in disseminating some of this scientific and technical insights to a frontline worker, which they are able to consume in a more effective manner, right? So a lot of this work is happening as part of the Precision Health platform. So the way it happens is, let's say, when we bring in all different data sets together, either via public sector data, private sector data, civil society data, even sometimes talking to the community, then publicly available information either via social media or newspaper, all of that we bring together. Now, when I say bring together, there is an underlying architecture which exists where all the state departments has a certain, I would say, uniform infrastructure available. There'll be certainly customization which is relevant for each of the contexts. I'll speak about some challenges also in that process that we have had. But in the last couple of years, we have been able to integrate a lot of, let's say, weather-related data coming from Indian Meteorological Department, scraping some of the publicly available information across the country, right? And bringing together in an architecture. So whenever you move to the next state to identify different problems and support different stakeholders, we are able to do that more quickly and help with the uh, help with the solution in the right time, right? So most of our solutions and the platform audience is typically the governments and the local communities or the civil society organizations who sort of consume this information, right? And again, since this information goes via, let's say, either a playbook or even a simple text message, sometimes it's via a handbook that goes to the frontline workers in a print version, sometimes it could be a chat bot, all of that is available, right? Then what it helps is that, okay, it provides a hyper-local solution which helps the frontline worker or a civil society organizations to work with the communities to protect themselves from any of the climate-mediated health risks that are emerging in the particular geography. Now, why it is innovative in a way? Because over the past years, we have seen that bringing all these data sets together and also working with the community is always challenging. So we are able to do that because of our expertise across working with almost 1,000 plus community institutions across the country, working with almost 10 plus different state governments plus national governments in India and likewise in Philippines as well. And also having the cutting edge technologies like GIS, AI, and also bringing different domain expertise that we have across the Catalyst platform, right? It allow us to basically bring in all the different data sets together along with the relevant domain expertise, which helps in providing a right solution at the local, hyper local level, and also enabling the frontline workers to act on the ground in a timely manner, so they can protect the vulnerable communities. Now I'll go into a bit of technical details about each of these tools. I think these are the 5, 6 different tools that we have been using in the past, and it's not a laundry list of tools. It also evolves as and when the different use cases are being developed and defined as well. So what it does is, let's say, water-based epidemiology, where we had used across 5 different cities in during the COVID time. Then we sort of expanded it to other diseases like influenza, hepatitis, and all of that as well. So what it allowed us to do is like predict the COVID a week in advance, right? Because there is a science which tells that you share the virus of COVID much before it can be clinically diagnosed in the hospitals, right? And specifically, the core principle that we wanted to follow is also to cover the vulnerable communities who typically are not covered under a well-established infrastructure, right? Because we come from the public health equity point of view. So what it allows us is that when we sample the wastewater from the open drains, right, typically which are not part of the sewage treatment network, which is established by the municipal governments typically. So, but when you sample from the open drain, it also represents the community which are staying nearby and does not have access to well-established, let's say, sanitation infrastructure. So, because of this, and when we mapped out all the sites that we are doing about, let's say, almost 50 plus sites for over 2 years when we're doing regularly, we realized that we were able to cover almost 86 to 90% of the population across the city. And again, Bangalore is a city of almost 15 million population, right? And when I talk about these 5 cities, almost we are catering to 25 million population, right? But based on the GIS and using certain technologies where we are able to map how would water flow from one wastewater to another wastewater based on the topography, based on the elevation, based on the slope, all of that, right? And also using the, let's say, neighborhoods typology mapping, where we are able to use, let's say, vegetation, street network, heights of the buildings, density of the population, all of that, and understand which are the most vulnerable population for specific diseases like which are, let's say, communicable in nature, like COVID or hepatitis and whatnot, right? Different, I would say, communicable diseases could be identified, and the same method can be applied wherever those are identified in the wastewater. And we were doing something with event-based surveillance where this is again pre-chat GPT era, where we are scraping all the internet media articles across the country, not only in English but all local languages as well, where we are used to filter and summarize and put it in a certain way which is consumable in nature for the relevant stakeholders, right? Once these are available, instead of a human spending almost, let's say, a week going through about 100 articles, now this makes the entire process smoother within an hour or so, right? So now you have timely information, probably more advanced in nature as well. So let's say by the time you summarize and have all the information, the disease would have spread. But now when you know that, okay, there is a disease that is going to be likely coming in, let's say, Bangalore, so it's also likely to be affecting, let's say, nearby cities. Just giving an example like that, right? So how do you act on time so you can work with the vulnerable communities in advance? Likewise, we are using a lot of GIS data. Again, this is something I won't go into the details of technical methodology, but what it does is that using relevant 6, 7 indicators or factors which can influence floods in a particular geography, we are able to identify which are more likely to be flood prone at the village level. Now we are using quite a bit of indicators like digital elevation map, distance from water body, topographical wetness index, and all. And then there was a model which was well accepted by the researchers in the country, like say Nepal, Bhutan, and all of that. So we are using similar model like analytical hierarchical process, where having a contribution from the experts where they define which is more likely to be affecting flood, right? Likewise, this is just an example of a flood, but this also applies to different events like even sometimes drought, sometimes climate and temperature related distress that are going to happen. So likewise, bringing all this data architecture in a way where there is a timely, let's say, communication which is available to the government or local partners, either via dashboard, reports, or systematic alerts, but also bringing the feedback loop from the ground workers on saying that, okay, this is how the data and information is right? Look, because we also have a lot of community base across the country. So we get that feedback and are able to improve over time. Now, this is broad data architecture that we have in place. I'm just going to talk about where it is operating right now. I mean, we are operating across 3 different states of India: Meghalaya, Andhra Pradesh, and Tamil Nadu, and one province in the Philippines as well. Where again, the use cases are defined along with the government and the local partners who are working there, because they know the geography best right now, correct? And to effectively use their expertise and also bring our expertise, we sort of try to marry both together and also then work with them to develop the solution and disseminate the solution and an entire chain of the actions, right? So in Meghalaya, we are working in the One Health domain where at the intersection of animal health, human health, and environment. Then in Andhra Pradesh, we are largely focusing on how heat is affecting different health-related interventions, specifically on RCH and typhoid. Then in Tamil Nadu, the focus is on scrub typhus and antimicrobial resistance. And likewise in tobacco cities, was more broad at the governance level on how do you improve the health service delivery, right? Now, all of that has a different use cases and entire architecture uh, uses basically different components from that. Now, let's say a lot of modeling that we do, I'll just give you an example how we also approach. Let's say I'm just giving a use cases from Tamil Nadu where we are trying to predict the scrub types across different places. So how do you use, let's say, health data along with environmental data, which is available publicly via satellite, the geography data about land use, the agroclimatic zone, vegetation covers, and likewise, right? So bringing all of this together allows us to work with the system to understand, okay, where is it likely to be happening, right? But since this is a technical conference and the audience as well, I'll put out certain challenges that we have been facing over last few years, right? Specifically, access to the hyperlocal GIS data. I think some of the times we are able to access some data set at the, let's say, probably 1 by 1 kilometer level, right? Not beyond that. Sometimes even 10 by 10 kilometer level. This depends on the satellites and the type of data available. So I would love to hear about how do we access more hyperlocal data sets so we can provide much better insights to the communities and also help them protect themselves from all the climatic risks that they are facing. Then creating an architecture. So a lot of time while we have the architecture in place from the design point of view, interoperability becomes very crucial, right? So some of the data sets which are available across different states may not be talking the same language across, right? So how do you make them interoperable so that you have a larger and larger data set available when you replicate to more states, and also use that as a training and test data set so you have a much more better confidence in the type of models that we are developing. Then there are certainly context-specific challenges. So let's say when we are trying to do flood mapping for the state of Meghalaya, we realized that the flood mapping, the way we were imagining, will not work there because these are the hilly regions where landslide is very common. The road networks are very differently designed and all, right? So how do you deal with specific challenges like context, like let's say northeast of India, where the entire topography is very different, right? Likewise in Tamil Nadu, since they are closer to the coast, they also face different challenges around rainfall. Suddenly the rain will change or delay or come early by a couple of days, right? There will be sudden flood. So how do you get some of these early warnings in advance? Is something I would love to hear based on everyone's experience there as well. But yeah, these are some of the challenges that we have been facing, and I'll stop it at there. But happy to answer any question and sort of address anything that you might have on the platform. Yeah, thank you so much.